Hey guys, so I was just checking back in to update you all on my mom's phone call from the doctor this past week. But for those of you that are new, I will kind of catch you up on where we're at and then fill you in on the information that the doctor provided. So, my mom was diagnosed with breast cancer a little over a year ago. Her surgery was, her double mastectomy was a year ago. So, anyways, fast forward to January 1st this year. She was running a fever of 103, went to quick care, and her white blood cell count was 16,100. So they sent her to the hospital. I took her to the hospital. They drew her labs like 4 hours later, and her white blood cell count had shot up to 18,100. So they did decide to keep her. She ended up staying 5 days, but so while they were there, they did do a CT, and they found some fluid behind the expander that she had placed a year ago, not the one she had placed like 4 weeks prior. So that was kind of crazy. But she had remembered that the radiation oncologist had said that she had seen it on a scan this at the end of the summer. So she told them that, but they said, this is protocol. Like, you have an infection somewhere, we don't know where, so we have to take it out. So on January 2nd, she had the expander taken out. They, of course, did blood cultures, and not just blood cultures. They did blood cultures. They did, of course, lots of labs. And then whenever they took out the expander, they sent that off for culturing, all of which came back fine. So they never determined the cause of the infection. I went with her to the oncologist a couple weeks ago, and I asked the oncologist about two things. One thing was the ctDNA test that I want her to have every 30 days because her cancer grew from 9 millimeters, which is a pea size, to 90 millimeters, which is 3.5 inches, in about 3.5 months, waiting for her double mastectomy. And so, if that can happen in 3.5 months, then I think it's very necessary for her to have the ctDNA test done every month instead of every 3 months, which the doctor is still refusing to do. The other thing I spoke to the doctor about was her oral chemo was called Verzenio, because I looked up the trial studies on these online. It's called the Monarch study. So they did like Monarch 1, Monarch 2, Monarch 3, and Monarch E. And so I was looking those up, and I wasn't just looking to see like what it did. I was looking for the all-cause mortality, because at the end of the day, like, I think that that's what all or most people care about. Because if the all-cause mortality is the same at the end of the day, or very little difference, and you're taking a medicine that makes you feel really bad, then you may not want to take it. Like, and I believe that doctors should have to give you that information before prescribing it. But that's just my opinion. So I asked the doctor about the Verzenio, and I had the study printed out, one of the studies with me printed out, and she was like, "Oh no," she never even looked at the study, but she was like, "Oh no, it does like it's like 50%." I'm not clear what she was saying is 50%. I'm not sure if she was saying like it reduces growth by 50%, because that's the mechanism it works on the CDK4 and 6. So it slows down cell growth. And so I wasn't sure if she was saying like it slowed it down by 50% or like increased your survival by 50%. I'm not really sure. Or like progression free disease is another big factor by like 50%. I'm not sure if it like helped what she was referring to, but nonetheless, I immediately came home and looked up all the other studies, and none of them are 50%. So the Monarch 1 they didn't do, there's not an all-cause mortality rate on there, but there is a progression-free disease, and it's 4.2 to 7.5%. And then on the Monarch 2, on the people that took the Verzenio, the all-cause mortality rates like 63.45 versus 70.4%. So I'm not sure like what these numbers are exactly. It's the but it is all cause mortality rate, and there's 7% difference in that one. And then so on the Monarch 3 study, it was like 19.21% versus 18.8%. Again, I don't understand all this. This is just for informational purposes, educational purposes. I'm not giving out medical advice. I'm just educating you guys on what I found and suggesting maybe you go look up this information on your medications. But anyways, for the Monarch 3, there's like 1% difference, if that. And then the Monarch E, which was the largest study they did, it had like 2,791 people on the Verzenio and 2,800 people off of the Verzenio. And the people on the Verzenio, it was 1.36. The people off the Verzenio was 1.29. Again, like not even 1% difference on the all-cause mortality. So if this is a medication that's like making you feel like you're chained to the toilet and can't have a quality of life, like I feel like the doctor should have to share this information before telling a patient like this is what you need to survive, and then quoting like misquoting the percentages. So when the doctor called my mom last week, she did tell my mom that the study that she found was 7%. So whatever she was looking up was 7%. My mom wasn't 100% sure if she was referring to progression-free disease or all-cause mortality. Nonetheless, it wasn't 50% like she was telling my mom. There's nothing that was 50%. Other than maybe some of the side effects. So the doctor called and told her 7%. I guess she had never looked at the studies for herself. Maybe she just took someone else's word for it and has been passing along bad information to her patients. So, if I'm in this situation, I'm going to be looking up the medications at the all-cause mortality rate. So, yeah. Keep me posted. Let me know if any of you guys have experienced this as well. And I will update you guys soon. Thanks.